Fernando, are you here? Good. Thank you for joining us today. We welcome you.
Good afternoon. My name is Fernando Quintero, and I am a communication strategist at Berkeley Media Studies Group. Today, I'm here to talk to you about the problem of target marketing of sugary drinks to low-income families and communities of color. Communities of color, as we've mentioned, as we've heard, have been hardest hit by the current epidemic of diabetes and other nutrition-related diseases. Meanwhile, communities of color are targeted by marketers of junk food that is high in sugar, salt, and fats, and sugary drinks, which contribute to childhood obesity. While target marketing to specific individuals and communities is a routine business practice, many foods and beverages marketed to communities of color are likely to increase disease risk or interfere with management of chronic conditions, especially in the absence of healthier food and beverage options. For example, a 2014 study published in the American Journal of Preventive Medicine found that Black communities were among groups most disproportionately exposed to child-directed marketing displays at fast food restaurants. Children who eat fast food are likely to consume more calories, saturated fat, sodium, sugar, and sugar-sweetened beverages. They're also less likely to meet dietary recommendations for fruits, vegetables, and dairy. African American children and teens saw more than twice as many ads for sugary drinks and energy drinks on TV compared with white children and teens in 2013, according to a report released last fall by the Rudd Center for Food and Policy at Yale. Just as beverage companies are spending more money to target African American youth, they're also pursuing Latino youth and other youth of color. Advertising for sugary drinks and energy shots on Spanish language TV increased by 44%, the Rudd study found. More than 84% of all foods and beverages advertised to children on Spanish language TV are unhealthy. A comprehensive review by the Institute of Medicine concluded that food marketing affects children's food preferences, purchase requests, diets, and health, which some also refer to as the nag factor. Youth of color get what researchers have termed a double dose of unhealthy food and sugary beverage marketing, because they are exposed to targeted as well as mainstream campaigns, particularly via digital media, which research shows is consumed by youth of color more frequently than by white youth. Marketers also target youth of color because they are deemed trendsetters and therefore exploited for what marketers call their brand ambassador capabilities. In addition, companies exploit the popularity of celebrities of color as role models by hiring them to promote unhealthy food and sugary drinks. Marketing is generally understood as depending on the 4 Ps: product, price, place, and promotion. Target marketing of food and beverages to communities of color occurs in all 4 categories. Companies have designed products especially for communities of color. They're priced, the prices are designed to appeal to specific income groups, such as value menus, targeting low-income communities. Price comes into play with target marketing when communities of color are disproportionately represented in poor neighborhoods. Places that are saturated with unhealthy food products and promotions, such as zoning in certain communities that allows concentrations of fast food restaurants or proliferation of outdoor advertising of unhealthy food and sugary beverages. Promotion that exploit cultural images, symbolism, and language to sell products or to build brand loyalty. This target marketing is problematic when the foods and beverages that are marketed using these techniques are unhealthy. In addition to the 4 Ps, soda companies direct corporate social responsibility campaigns, and philanthropic support toward organizations of color that are often strapped for resources, including youth-serving organizations. Some companies also provide important financial support to students of color, such as PepsiCo's scholarships for Latino journalism students, or Coca-Cola's first-generation scholarships for U.S. college freshmen who are American Indian or Alaska Native. Furthermore, complicating matters, these companies in their marketing have long promoted positive images of people of color, and sadly, this is something that is sorely lacking in other media. But all this support from food and beverage companies does not negate the fact that their products have contributed to the devastatingly higher rates of diet-related diseases in our communities of color. So what can we do about target marketing of junk food to communities of color? Because communities of color are specifically targeted, a targeted approach is needed to address the marketing of their unhealthy products, especially to our children and youth. We must ensure that responsibility begins with those who produce and present marketing of unhealthy products. It is a shared responsibility. We can strengthen nutrition standards at the federal, state, and local levels. We can improve labeling information that gives consumers a fair chance at making healthy choices. We can impose excise fees, like the one successfully passed in Berkeley, to fund programs aimed at reducing the health harms brought on by these unhealthy drinks and food products. We must cover all forms of marketing to include packaging, sponsorship, schools, toys, mobile devices, and so much more. In the end, we must reduce exposure to unhealthy beverages and food, especially among kids who are suffering the most. This aggressive, predatory marketing of food and beverage products that are proven harmful is unfair to our most vulnerable communities, especially children, and this must change. Thank you.
Thank you very much for your presentation. Colleagues, are there any questions? Okay.